Whenever my mother go to the market and I come back from school, he will come into my room and sleep with me.
And sleep with you?
Yes. And he told me that when I told my mother that he's going to kill me.
Oh, seriously?
Cases of gender-based violence have become a global phenomenon and were more pronounced during the COVID-19 pandemic. Many people, especially women and children, have been victimized in one way or the other, the impact of which mostly affect their health status.
And when you talk about the issue of gender-based violence, you won't succeed without discussing the health component of it, because health serves as the first point of entry whereby most of those survivors are prone to seek the first medical intervention, because when we talk about example like rape, when a rape case happen, usually the family of the survivor tend to go to the nearby healthcare facility to seek for medical intervention.
Our healthcare workers in the first place, they can't even recognize a GBV survivor when they come to the clinic. A lot of people come to the clinic, they're actually survivors. They don't talk about it because violence is something that everybody wants to hide. Nobody wants to agree that he or she is being violated.
Addressing cases of gender-based violence in Nigeria require a multi-sectoral approach whereby various ministries and stakeholders, including international donors, come together to find a lasting solution. This is what informs the decision of the USAID-funded Integrated Health Program IHP, in collaboration with the federal and state ministries of health, to organize this training of trainers for frontline health workers on gender-based violence care and support.
So one of the cornerstone or pillars of IHP, working with the states, is to ensure that the system is responsive to survivors or victims of gender-based violence.
We hope that, and our health indices too, will be better. So we believe that this training, that by the end of the day, by the time they go to their respective facilities, they'll be able to handle such cases better than they've done before.
For issue of gender-based violence, one aspect or one component will not serve all the purposes.
More than 60 participants who are nurses and midwives formed part of this training and are expected to step it down to other health workers across the 20 local governments in Bauchi State.
These competent providers, trainers, are going to cascade the training in health facilities.
What we really expect from them is that the cases of GBV will be going down.
We hope that when they are going to cascade this training down at the facility level to other healthcare providers, they should be competent enough and they should be confident and bold to discuss issues around gender-based violence.
These giant efforts put in place by the federal and state ministries of health in collaboration with USAID-funded Integrated Health Program IHP can go a long way in addressing the health challenges of gender-based violence in Nigeria. Awal Hassan, Viewer TV News, Bauchi.